My name is Martin Agoje, the President of ISSUP Nigeria Chapter. It is another session which is the 12th of ISSUP Nigeria Chapter bi-monthly webinar tagged ISSUP Nigeria Knowledge Update series. First, let me apologize for starting a little bit behind schedule. This webinar is coming a few days or a few weeks after the ISSUP conference in Abu Dhabi, where some of us had the opportunity to meet one-on-one. I must say that the ISSUP conference in Abu Dhabi was a wonderful experience. So today, as usual, we shall be looking at another important topic, which is substance use and risk sexual behaviors, targeting adolescents. So as usual, I know that participants will have questions to ask. Please feel free to use the chat box to send your questions and share your thoughts as the presentation will be going on. So to moderate this session with me today, we have Ejikeme Magbishop Oguje, who is a member of the editorial team of ISSUP Nigeria Chapter. We also have Bawo James, who is the Publicity Secretary of ISSUP Nigeria Chapter. So quickly, let me introduce the speaker for today, just before she comes on board. The speaker for today is Dr. Ndidi Mercy Ofole. Ofole holds a PhD in Counselling Psychology from the Department of Counseling and Human Development Studies, Faculty of Education, University of Ibadan, Nigeria. She is currently a senior lecturer in the same department. She's a member of the American Psychological Association and the immediate past chairperson of Counselling Association of Nigeria, Oyo State Chapter. Ndidi offers counseling services to diverse target populations in the following areas: adolescents, reproductive health, addiction, mental health, drug and substance use prevention, health promotion, among others. She is a youth coach who consults for UNICEF, Partnership for African Social and Governance Research, that's in Kenya, different ministries, departments, and agencies, and non-governmental organizations. She's a pioneer member of the International Society of Substance Use Prevention and Treatment Professionals, ISSUP Nigeria Chapter. Dr. holds, like I said, holds a PhD. She has over 60 publications in peer-reviewed journals and have made academic presentations at national and international conferences on harm reduction, drug use prevention, treatment, and rehabilitation, among others. So at this point, let me hand over to Dr. Ofole to take it up from here. Doctor, you're welcome.
Thank you very much, Dr. Martins Abuji. Good afternoon, good evening, good morning, participants. Any part of the world you are logging into, I'm highly privileged to have you listen to me this afternoon. I must appreciate the President ISSUP Nigeria, Dr. Martins Abuji, for giving me this rare opportunity of presenting the 12th bi-monthly ISSUP Nigeria webinar. Sir, I'm very grateful. The learning outcome for this title is, at the end of the presentation, is expected that we should be able to gain a deeper understanding of the concept of substance use, sexual behaviors, and risky and adolescents. The second learning outcome is that we should be able to discuss the connection between substance use and sexual behavior. The third is we should be able to highlight appropriate strategies to for reduction for this cohort. The first concept is substance use. Substance use in this discussion is taken to mean drugs, substances that are chemical that can change how the body and mind work. They include prescription medicines, over-the-counter medicines, alcohol, tobacco, and illegal drugs. Many people will use substances at some point in their lives without any issue as they grow up. However, substance use becomes an issue when it starts to have harmful effects on someone's life. For example, for a student who is going to school, is beginning to have difficulties at school or having negative impacts on mental or physical health. Substance can change the brain functions in many ways. These changes can affect the individual's perception, the mood, the thinking, and of course, the behavior. There are different types of alcohol. They are not limited to this. With great apology, we have different alcohol, but we are just showing that some of the things that they use can be drugs, can be alcohol, and it can be cigarettes. Substance misuse. Substance misuse is the use of alcohol, illegal drugs, over-the-counter or prescription medications in a way that are not meant to be used. For instance, asking our friend or our colleague or a family member to share part of his or her drug for us is a substance misuse. Starting a medication and stopping at the middle without completion is a drug misuse because the dosage has not been reached. People can misuse substances one time, occasionally, or regularly, and they can go to develop substance disorder. Substance disorder comes in when the use of alcohol or drugs now impairs on health or how one functions in their daily life. So it now becomes a problem. In the past, substance use disorder is normally used as a substance abuse. But because that word abuse is trying to portray the fact that the individual could even actually help him or herself. But we know that substance use disorder is a problem. So just like we have other medical issues and challenges in life, substance use disorder is an issue. It's not really an abuse. Substance addiction, also known as severe substance use disorder, is a brain disorder that manifests as the uncontrollable use of a substance despite its consequences. People with drug addiction, they have a physical and or psychological need to take a substance because they suffer intense or debilitating withdrawal symptoms when they go without the substance. That is to say that they have a lot of withdrawal syndromes. Even with all their effort to stop the usage, they cannot help themselves. The commonly misused substances in Nigeria are alcohol, including beer, wine, distilled spirits, nicotine. People take nicotine in different forms. For instance, cigarettes, even this coffee we take occasionally, cigars, e-cigarettes, smokeless tobacco. All these are some of the commonly misused substances. Marijuana, including cannabis, opioid, and so on. These are some of the circumstances, some of the substances that are being misused occasionally. But the one that is gaining a greater prominence now in the Southeast is the one that is normally known as mkpụrụ mmiri. Yes, that is amphetamine and methamphetamine. I want to add that apart from this one so listed, Surprisingly, some of the young ones and adolescents, they use things that one would not even expect that they use in order to get the same feelings, euphoria. Some of them go to the extent of sniffing, use pads, use pampers, smoking some leaves, sheets, stools, and so on. These are some of other commonly misused substances that are categorized under others. The next concept in this discussion is sexual activities or sexual behavior. Sexual activity or behavior is any activity, usually solitary, that is done in a very hidden or quiet place between two persons, or sometimes one person, or in a group, that induces sexual arousal. They are categorized into two. There's non-penetrative sex, such as masturbation, that is individual masturbation, self-pleasuring, mutual masturbation between two people, kissing, fingering, and all sorts of non-penetrative sex. Then there's also penetrative sex, which is normally called heterosexual sexual relationship. The concept of adolescence. Adolescent in this discourse will be used interchangeably with teen, teenager, and so on. But I want to call our attention to the fact that adolescents expand beyond teen and teenagers. Because when you take adolescent and categorize them into early adolescent, middle, and late adolescent, some adolescents dovetail into young adults. But for this discussion, we are looking at adolescent, the teen, the teenagers, that is young people. The World Health Organization defines an adolescent as any person between ages 10 to 19. UNICEF defines youth as individuals between 15 to 24 years old. That will mean that the adolescents and the youth, they overlap. Adolescence is a phase of life with its own special needs. With its own special needs, it also provides an opportunity for these human beings, for this adolescent, to also contribute to developmental issue. That is why it is said that it's an important time for laying the foundations of good health. Adolescents experience rapid physical, cognitive, and psychosocial development. And all this development affects how they feel, how they think, decisions they make, and how they interact. Adolescents in Nigeria. We may be wondering, why Nigeria? Why adolescents in Nigeria? Yes, every society recognizes that there's a difference between being a child and becoming an adult. However, I want to call our attention to the fact that adolescents are not homogeneous population. Though they may seem to have some similarities in some aspects, but they differ. For instance, their needs vary on the basis of whether they are male or female. Their need varies based on their stages of development, whether they are at early adolescent, middle, or late. And the socioeconomic circumstances of their life differs. Presently, as at 2018, Nigeria has an estimated population of 191,835,936 adolescents. That is 22%, 192 population, out of which 22% are adolescents. That is why most researchers and stakeholders, they concluded that Nigeria is an adolescent and youth population, because 25% out of the whole population is a lot. Therefore, adolescents in Nigeria are very peculiar because some of the adolescents we are talking about, their own socioeconomic circumstances differs from that of their colleagues elsewhere in the world, especially in the developed world. Some of these adolescents are even not in homes. Some of them are in IDP camps, that is internally displaced persons camp. Some of them are hawkers, they are on the streets. Some of them are heading homes as a result of the death of one or two of their parents. Some of the Nigerian adolescents are the ones fending for their homes. And some cultural issues made some of Nigerian adolescents mothers, even while they are still growing up at the ages of their adolescent development. So that is why we say here that adolescents in Nigeria, they are growing up under a different circumstances. The link between substance use and sexual behavior. Health compromising behavior, such as substance use and risky behaviors, both of them are called problem behavior because they constitute a deviation from conventional behavior. We know that every setting, both in the family, any organized setting, frowns at an adolescent being involved in sexual behavior or taking substance. So when they are done, when both of them take place, that is why they said they constitute a deviation from the norm. In addition, these behaviors are reported to co-occur. That is, as one is occurring, the other one is also occurring. The association between substance use and risky sexual behaviors have been discussed from two theoretical perspectives. The first theoretical perspective is that both of them constitute a deviance. Others view substance use as preceding risky sexual behavior. That is, they were of the opinion that some of these adolescents will need to take drugs before they involve in risky sexual behavior because they will need substances and drugs for thought distortions. The later school of thought conclude that substance use acts as a gateway to sexual behaviors. The scenario, let us paint the scenario better here. You could notice a party scenario. So in growing up, adolescents are confronted with three deviant yet coercing opportunities. These three behaviors are deviant, but they are very strongly provided. One of the options is to take alcohol. The other one is to try drugs. The next one is to have sexual intercourse. In many cases, taking the alcohol, taking the substances, and involving risky behavior, they are linked together. Because it has been seen that anywhere alcohol is offered, there is possibility that illicit drugs, such as marijuana, will be given. When drugs are available to adolescents, usually alcohol will also be present. At parties where drugs and either only the drug or in addition to the alcohol are presented to adolescents, the next thing is that they involve in risky sexual behaviors too. A study by Ofole and Ofole 2021 documented that teens who drink or use drugs are much more likely to partake in risky sexual behaviors than the non-users. Teens Some other study by Woge, 2016, report that teens who drink or use drugs are more likely to have sexual intercourse at an earlier stage of their life than non-users. Likewise, substance use were associated with the number of sexual partners, such that adolescents who use drugs or any substance can have multiple partners as much as 8 to 16 when you compare him or her to adolescents who don't use drugs. Adolescents who use drugs or drink will have transactional sex. That is either sex for money, for mass, for food, or for drugs. Reason being that they need to have a transactional sex in order to fund the drug usage. Further, adolescents who drink alcohol and use substances are more likely to engage in unprotected sex than non-drinkers. Unprotected sex means that they have sexual relationship without any form of protection, be it condom or anything. Because already having taken the alcohol and the other substances, they underestimate the risk of any infection. Another study also found that 1 in 5 girls and 4% of boys who use substances or take alcohol reported having sexual relationship with a partner 3 or more years older than them, which is known as transgenerational sex, a sexual relationship between a partner who is much more older than them. The burden of substance misuse in Nigeria. According to UNODC 2021 World Report, it is documented that as June 2021, that over 275 million people use drugs worldwide, while over 36 million people suffered from drug use disorders. In Nigeria, UNODC 2018, the National Survey on Drug Use and Health, done between 2016 to 2017, was quite revealing. Because number one, that was the first nationwide survey that was done to determine the extent and pattern of drug use in Nigeria in the past year prevalence of drug use, that is in 2018. It found out that 14.4% or 14.3 million people aged between 15 to 64 years in Nigeria, they are taking one type of substance or the other, including alcohol. With that figure, we will see that the extent of drug use in Nigeria is very high when you compare it with the global prevalence at 2016, which was 5.6. It is very high. The same report documented that cannabis was the most commonly used drugs, followed by opioids and mainly cough syrup and non-medical prescribed drugs. You will notice that some of these adolescents, they walk in, they pretend to have cough, they mix several substances together and they take. The average age of initiation of cannabis use was 19 years by the same study. It also documented that more men use substances when compared to their female counterparts in the past year drug use as of 2018. Out of 6 geographical zones we have in Nigeria, the report shows that the highest prevalence was in southern geopolitical zone when you compare it to the northern zone. However, in between 2008, when this study was conducted to date, there are other findings which have been reported by researchers. For instance, in the southwestern Nigeria, Obadej and his colleague 2020, they found that the prevalence of drug use in southwestern Nigeria was 17.3, which is very high when you compare to what was reported in 2018. The impact of substance use on adolescents. Most importantly is that being an adolescent, they are in the school setting. Majority of them are in the school setting, though we know that some of the adolescents are out of school. So when it gets to drug use, there's a declining grades, absenteeism from school, and other activities. And there's always increased potential for some of these in-school adolescents to drop out due to drug-associated problem. Most of them do not finish their secondary school because they have started using substances at early stages of their life. Marijuana, for instance, Igbo, which is normally known as Igbo in the Nigerian palace, or we have many names for marijuana. There's a very popular one here. Is said to interfere with short-term memory. It interferes with learning and psychomotor skills. So for an adolescent who in school, who cannot retain information in the short-term memory, cannot write with his psychomotor skill, doing academic activities, is already on the way to being out of school. Physical health. Of course, many incidents of injuries reported in Nigeria by due to alcohol or substance-related one. And some of these injuries could lead to affect the whole of their being. It has a lot of health-related consequences. Apart from the impact of the drug use or alcohol use on the adolescent itself, its usage is affecting other social network in the society. For instance, the family. In addition to their personal adversities, any adolescent that abuses alcohol and other drugs, it may result in family crisis, and it will jeopardize aspect of the family. Those who are into treatment and recovery, they have insight of this particular point. They know that most families spend all they have in order to support their family member who has a substance use disorder. So that is a major one. The next one is delinquency. Sometimes adolescents who use any of these substances, they begin to have problems with constituted authority. They are non-conformists. They have been arrested here and there, and they have one problem or the other. There's also mental health issues. They have depression, developmental lacks. Some of them have suicidal ideation. Some of them even go ahead to commit suicide as a result of, as a result that has been indirectly or directly linked to substance use or misuse. Now, why do adolescents misuse substances? Our understanding of knowing why they misuse substances will surely give us a new way to knowing the intervention that will capture them. One of the reasons is the period of their growth, that is adolescent stage itself. They have not matured. Their prefrontal lobes that is in charge of decision making is not well developed. They are still maturing. So some decisions they do is based on emotion. Some of them, they do not think rationally before they take decision. The next one is the promotional activities on the media. The promotional activities on the media give the impression that they glamorize the use of substances, alcohol, and cigarette smoking, even though at the end they will just mention it in passing. Cigarette, alcohol is dangerous to your health, just in a brief one, less than a minute comment. The next one is what the UNODC describe as dark web. Dark web, with increasing use of internet, it is discovered that just as young people and adults order for valuables online, some of these young ones now boycott adult monitoring and supervision. They go online to order for some of these usages. So it is dropped on their doors, even without the knowledge of some of their guidance. It is brought along with other items or on its own. They will just collect it as a package, delivered package. The next one that we are going to look at is the low risk perception. Definitely, we are going to talk about it in subsequent one, low risk perception. A study by Ayen in 2020 categorized some of the issues. The most important one mentioned here is peer pressure. Sometimes some of these young ones, they want to, for fear of peer rejection, because no adolescent want to be rejected by his or her peers. They want to belong. And if one of the conditions for self-acceptance, for peer acceptance, is to try and experiment to drug, they go ahead and take it, just to be sure that they still belong. They are accepted by their peers, because non-acceptance by their peers will erode their self-image and their self-esteem as a young person. The next in that hierarchy is curiosity. They have seen adults do it in the society. They have seen their parents, their guardian, they have seen it done in the television. They are also curious to know how it feels to be part of it. The next one is fear of isolation. Some adolescents, they have fear of not being able to relate with the others. Availability, accessibility, and affordability. Among these three A's, the one now is accessibility, because some of these things are not even bought with money. Some of the substances they now use, they don't need to buy it. They don't need to pay for it. It is readily available. It's accessible. Something like Pampers, pads, use pads, pants, and all this stuff are not. They don't buy it. Harm reduction for adolescents. The reality of drug use among young people continue to be an issue of concern to every stakeholder. Many predominant approaches that have been used in the past that did not work is just say no. That is, don't take alcohol, don't involve in risky sexual behavior. But it has been seen that despite all this done for several years, not much has been achieved in that particular approach. As a result, it has left this adolescent to be more vulnerable population. They have been silenced, they are neglected, they are stigmatized, and their needs are unmet, because most interventions are not targeting them. The one that targets them is just saying no. Now, harm reduction here is a collection of practical strategies and ideas designed to ensure that the health, social, and economic consequences of drug use, it is not based on abstinence-based policies and programming. Let me put it in a much simpler language. Harm reduction in the context of adolescents is designing a program that will minimize the health, the social, and economic consequences of drug use, not limiting it to only abstinence-based policies. This is because this movement is for social and health justice, that is believed that every individual has a right to his or her health. As a result, harm reduction should be a right-based approach. It is a right-based that as an individual, as an adolescent, they have a right to how they want to be attended to. Harm reduction program for young adults like I had said earlier, is just to minimize its impact on the young people themselves, their families, their peers, without mandating reduction in them. Harm reduction has been documented to be effective in different populations, including young people. CAN 2022 has reported that e-usage has been so effective in other clients. But even as that may be, there are major challenges that is militating the use of harm reduction for adolescents in Nigeria. Despite that, Nigeria is the most populous country in Africa and is a transit country for the passage of drugs to Western countries. This has, and other factors, has led to the increasing level of drug use in Nigeria. A major issue that we have in Nigeria is the very firm and the national policy which make both drug use and drug purchase to be a highly legal issue with a high level punitive measures. So Nigeria is here to adopt the policy of allowing harm reduction to be assessed as a treatment option. The next challenge we have in Nigeria regarding harm reduction for adolescents is lack of honest conversations about how to reduce harms related to drug use among adolescents. Stakeholders intentionally avoid to discuss it. In fact, I'm sure that when this topic was projected, some people will want to hear whether it will be supported or not, because everybody wants to be silenced when it gets to issue of harm reduction in adolescents in Nigeria. As a result of this negligence or trying to avoid it, the prevalence of the use, the extent of substance use disorder continue to increase. And stakeholders are yet to accept that drug use, drug misuse, and so on, they are part of the experimentation that goes up with growing up. So if other issues that has to do with growing up are being attended to, it's expected that issue of drug use should also be attended to. Another problem that we have as a major challenge for adolescents, for targeting adolescents with harm reduction in Nigeria, is parent consent in seeking treatment. There's a clause that before an adolescent of particular age will come for treatment, they must get their parental consent. And it has been shown that when adolescents begin to seek their parent consent for treatment, that they hardly come for such treatment. And that will mean they will be at more danger. Now, what works for young people? There are two things that work for young people. Number one is to recognize their role in decision-making as individuals. There's a saying that if it's for us, we must be part of it. If it's not for us, so it's not for us. So they must be involved in decision-making that has to do with their health. There are two ways to handle issues that has to do with harm reduction in adolescents. The first can be achieved by targeting those who have not initiated drug use at all, to enable them to delay the initiation of drug use. But the question is, assuming they have used the drug or they are still using, that is when you talk about secondary prevention. The primary prevention is delaying the usage, the initiation, preventing them from trying it at all. But when it is done, it's not like it's no remedy, no. The secondary prevention is the remedy. According to Simon and his team, they said that drug reduction should work on two principles. Number one, that it is critical to keeping young people alive. Number two, it should be offered at every opportunity, regardless of interest of any person, that the person who has the greatest control over that is the adolescent himself. And that all evidence-based harm reduction strategies that are available for adults should also be available for the adolescents. Effective prevention program should involve positive engagement of children, the youth, the adults themselves, because these individuals, they work in a network of people. Secondly, when focusing on parents, we look at parenting skills. What skills can we give to parents from the onset? Because it is with these skills that they have that they can use to initiate the primary prevention. In addition to that, there's this issue of closing the gap between perception and the reality. According to UNODC 2018 survey, it is seen that adolescents, their risk perception is low. That means they don't believe that taking some of these substances can have any harm. And as a result of that low risk perception, the increase in drug use is getting higher and higher. So stakeholders should work on how to increase the risk perception. Let them see the need that this is risky, and by so doing, it will reduce the usage of the drug and other substances. The next is to prioritize less drinking, young people who haven't started much drinking. In this concluding slides, I was able to outline some of the prevention goals and the equivalent activities that can be done. For instance, to reduce the spread of sexually transmitted and other bloodborne infections, including HIV and viral hepatitis. It is recommended that they should increase access to pre-exposure prophylaxis. There should also be increase in access to HIV and viral hepatitis testing and treatment. This treatment should not only be restricted to adults, like I had earlier mentioned. Adolescents are into transgenerational sex. Adolescents are into transactional sex. Transgenerational sex make it possible for them to interface with an adult who may already have some of these viruses. So sitting and not targeting them with some of these activities will not lead to the prevention goal. The next is to increase their knowledge of safer sex and sexual health. And one of the ways it can be done is through extensive and intensive sexuality education and drug use education. And when this information is being transmitted, it should be in a very scientific manner, not presenting only the aspect that is acceptable to us. The whole information regarding substance use, sexual relationship should be incorporated in the sexuality education. The next one is to reduce stigma and increase access to health services. How can it be done? It can be done by targeting peer support specialists and groups. Because when the peer, in the course of the presentation, we must have heard that the peer group, they have higher, those who take substances due to peer influence or peer pressure, they are quite high. So when you target, when one is targeting their peer support group, it's one of the ways to make sure that they get reduction services. Increase referrals to support programs and other support opportunities. Let them know the support services available to them. In a community, we should be able to know who is offering what and where, so that we can easily make referral to them. The last but not the least is counseling. Counseling, talk therapies, though the cheapest of them all, is very effective in harm reduction intervention, especially for primary prevention. We have different types of counseling intervention that can be instituted. One of the ones that can target risk perception is cognitive restructuring, to rearrange them cognitively so that they begin to have a real negative view of drug use. Because the low risk perception will lead to increase, but when the risk perception is high, the usage will be low. Reduce sharing of substance use, equipment, or whatever the adolescent that are found to be using drug. It should be well sterilized. They should be discussed about safe smoking supplies, syringe service program. Like I said earlier on, every services that are available for adult substance use user, an individual who have substance use disorder, should also be made available to an adolescent. But I know that one problem we have in Nigeria is the cultural issue and the non-accepting of the reality that adolescents are also involved. When you get to reducing spread of infectious diseases, we use different formats like using of making sure that in a social gathering they protect themselves, and adult monitoring. Let me make conclusion here to say that to grow and develop in good health, adolescents, they need information, including age-appropriate, comprehensive sexuality education, opportunities to develop their life skills, health services that are acceptable, equitable, appropriate, and effective in a very safe and supportive environment. They also need opportunity to meaningfully participate in the design and delivery of interventions. So any intervention for young people should involve them at the level of planning. It is not that after planning, we bring them up at the level of implementation. They must be involved at the planning level, implementation level, evaluation level, and monitoring level. We should advocate for the introduction and development of evidence-based prevention and treatment programs like we use in other countries of the world. We can still advocate that policies, these harsh policies on drug use and so on, should be softened, if polished, to be abolished, so that young people who are already into drug use can be assisted to still actualize and be a contributing self-individuals. Because any society that toys with its adolescent is toying with their future, because they are the future leaders. Though they say that their futures start from today. Thank you very much.
Thank you. Thank you so much, Ndidi, for that comprehensive presentation. I want to believe the participants have enjoyed the presentation. Incidentally, time seems not to be on our side for me to summarize some of the points you have already made. And I'm also happy that participants have been able to ask questions using the chat box, and that Bawo has also been able to follow up with some of the questions, answering some of the questions. Thank you so much, Bawo, for being able to do that. Just before we ask a few questions from what we have here, I will plead with ISSUP Global, Olivia and other colleagues there to please give us maybe 5 minutes after the time, so that we'll just have a little time to at least address some of the questions. First, so that we allow Ndidi to have a breath and Power comes in to ask the questions. Adeojo asked about the need to have a policy, drug policy for institutions and even the nation at large. Let me say that at the moment we do have the National Drug Control Master Plan, That is a national drug control policy document prepared by the major stakeholders in drug control in Nigeria. Even though there are always room for improvement, but at least we have that on ground at the moment. The latest edition is the one for 2021 to 2025. So that can also serve, in the meantime, in addition to the fact that, like I said, there will always be room for improvement. Dr. Grace asked about the data to use, especially now that we don't have or the survey that was conducted in 2016 and published in 2018. Evidence now shows that the trend in drug and substance use may have changed in Nigeria. So what do we rely on? Well, there are other studies, just like the presenter said, that we can rely on, but you will also agree with me that such national drug use survey captures much more than what individual studies can do. So let me at this moment hand over to Bawo to take it off from here.
Okay, thank you very much. And yes, to add to what you have said, Martin, it's the fact that perhaps it's to stimulate, based on the beautiful presentation we've heard today, to stimulate the discourse, particularly in our institutions, because that's usually at the point at which much of our adolescents seem to go south. There's a question for our presenter. There are several questions today, but we will not be able to take most of it. We're just focusing on the questions that are related to the topic that our presenter has taken. So she wants to know, can Nigeria come up with a drug direction strategy in our institutions? I know you've already highlighted some things we could do in your conclusion. Perhaps you may throw some light on it, specific to our institutions. And then the second question we'll take would be mental health disorders as induced by substance and high sexual activities. How can we culturally tackle it, knowing the pressure from the environment that they live? So could you please take these two questions for time's sake? Thank you.
Yeah, sorry to interrupt. Ndidi, if you don't mind, I wish we can see you. Maybe it's the camera so that the participants will have the at least the privilege of seeing your face, because we couldn't do that during the presentation. But if it is being an issue, you can ignore it and go ahead with the response.
Open this is blocking me. It's blocked from this angle.
Okay, please just go on and answer the question. Okay.
Can they see me now?
Yes, please. Yes, we can.
Okay. Okay, you said I should go on with the question.
Yes.
Someone was trying to find out if there's any cultural means of controlling drug use and risky sexual behavior. Did I get the question right?
Yeah, it says mental health disorder induced by substance use and sexual activity. How can it be culturally tackled, knowing that our adolescents are in there's much pressure from the environment where they live? Yes.
Yes. Thank you very much for that question. We talk about ecological theory in counseling. Ecological theory is recognizing the fact that substance use and risky sexual behavior, they succeed with multi-sectoral approaches, multidisciplinary. That means every person is a stakeholder in this business, starting from the parent, the school, the churches, the mosque, every individual, because either they are reinforcing, they are facilitators of the drug use, or so all the network will be worked upon for them to have a stoppage like she has observed. Thank you.
Okay. The other question is what and we know you spoke about access and the difficulty sometimes that young people have accessing appropriate care. So someone wants to know, sometimes an adolescent may want to stop the drug usage, but couldn't do that on his or her own. what better way could be appropriate for such a situation?
Thank you. That is why I mentioned that as stakeholders, the main thing we even need to know now, because sometimes I see in our platform that people will be asking, do you know any treatment center? Can you? So we need to compile list of those organizations or individuals who provide services and make it available. Because sometimes parents will call you, please, I have someone, where can I make referral? You see? So that one is one of the basic ways, one of the things we can do, that referral, knowing that sometimes we need expertise. But counselors, counseling psychologists too, they are available, and they are available in the school context. But the truth is that most of the counseling psychologists in the school settings, they look down on them. Some of the society think they don't have the skill. But basically, any counseling psychologist in the school setting can offer preventive services and even referral to the appropriate center.
Okay. Thank you very much for your response. We have quite a number of people who have said they want to receive the PowerPoint presentation. If you're on the ISSUP Nigeria WhatsApp group, I'm very sure that the president will make that available, as is our practice. And also the video of today's presentation, I think at some point will be available on the ISSUP website. Ejikeme, please, if you could please take 2 more questions from the list for our speaker, and then we hand over to the president. Thank you. Ejikeme, are you there, or do I just continue? Okay.
Ejikeme, sorry, we can't hear you. Maybe you are muted.
Okay, can you hear me now?
Yes.
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 Okay. Sorry for that. So thank you, Doc, for the wonderful presentation. There is this question here, and the question says, do you see any correlation between drug addictive behavior with sexual problem of youth in Nigeria?
Are you done?
Yeah, that's the question.
Yes, that's the target. That is the main crux of my discourse today. It is shown that it's well documented that is a high correlation between substance use. She may want to know how. The thing is that substances, they distort thoughts. I give them instances. Somebody will go to the beer parlor. At the first instance of being served, you will notice that the person who is serving you is not neat. He's not neat person. But as soon as 1 or 2 bottles are taken, the name will now change to something else. The thoughts begin to shift. So there's a strong relationship between substance use and risky sexual behaviors.
Okay, there's this question. The question says, from 2018 till date, how can we get current statistics of substance-induced sexual activities leading to mental health in Nigeria?
It is very difficult to do that kind of a study. To get the target sample will be very difficult. Is it that, because that would mean two levels of purposive sampling. Number 1, you get the individual who have sexual relationship. Number 2, find out whether they took drug before the sexual relationship. In Nigeria, I don't think the respondents are matured enough yet. Maybe online survey can get the information anyway. But I don't know if you ask them, online survey can do it. So thank you for opening up that line of research. Thank you.
Okay, thank you so much. And then Dr. Martins.
Thank you so much, Ejikeme. Thank you once again, Bawo, and our speaker, Ndidi, for this great job for today. Just to add to what Bawo said earlier, the slides for this presentation will be shared on the website too. so that participants from across the globe can download the slides from the website. You can just go to visit the ISSUP Nigeria chapter side of the ISSUP global website, and you'll be able to access the slides. This topic, you will agree with me, is very important and delivered by someone who is very well grounded in this area. I want to encourage participants to use the experience from this webinar to affect the young population, especially the adults. And like the speaker said, most of them are in the school setting. No wonder the question about developing policies or strategies to address substance use prevention in the school setting. That indeed is very important, because as important as the national document may be, that may just be the basics, upon which the different settings, can develop policies or strategies upon which they can affect the different strata of our society and across the different age brackets, with emphasis on where they can actually be reached. The adolescents are expected to be in school, and of course, majority of them are in school, like in Nigeria, and the young adults that are possibly transiting to workplace and so on. So we need to put these policies and strategies in place to address different settings. Like I always say, the family setting, very important, the school setting, very important, the workplace setting, even the faith-based setting, as well as the community setting. These are different settings within which we can comprehensively address the issue of drug and substance use in our society. So once again, I want to thank the participants for your questions and for being patient with us. And of course, we want to encourage you to be part of our sessions again. And I want to, once again, on behalf of ISSUP Nigeria chapter, to thank Olivia, Radov, and other colleagues from the ISSUP Global for always being of support to us. So once again, we look forward to another session, and we do hope that you will make our time to join us. So at this moment, I will say bye for now.